Hello, this is Dr. Sam Sunshine with OC Sports and Wellness, where we have a direct primary care membership that gives people awesome care. So today we're going to be talking about the vaccine and how to get the vaccine. So there's a lot of concern and interest among the patients that I serve in my membership that are having these questions. Where do I go? How can I get the vaccine? Is it safe? Does it contain shellfish? Is it effective? And so I'm going to kind of answer some of those as we go along here. So I'm going to share my screen and we are going to get started. So this is the COVID-19 vaccine update for today. And again, I'm Dr. Sam Sunshine. If you are in the membership, you have any questions after listening to this short video, please send us a message through Spruce and we can help answer those. Again, there's a lot of resources I'm going to provide to you today that will allow you to go to certain websites and glean some information about the vaccine. Okay, so recent changes to the federal guidelines. The health secretary recommended that we open up eligibility in phase 1A to include people 65 and older. So that's now going to increase the number of people who are going to be in this phase 1A that previously was just the healthcare workers and then residents of long-term care facilities. And those are healthcare workers that are in the front line, really taking care of acutely ill patients and a lot of the COVID patients. And then not only age 65 and older, but adults at any age with medical conditions that put them at high risk of becoming seriously ill or dying from COVID. And that could be underlying heart disease, kidney failure, people with type 2 diabetes and cancer who are ongoingly receiving treatment for cancer. Summed up, this is about 150 million Americans. And that's going to take time to vaccinate everybody. And we have to exercise some patience here. We are vaccinating people at hospitals. These are healthcare workers, long-term care facilities are being vaccinated currently. Vaccinations started about a month ago, and I think the vaccine rollout has been a little bit slower than expected. So far, I think it's 4 million people in the US have been vaccinated, with the anticipation at this point of having 20 million people vaccinated. So we haven't quite hit our marks. Part of it is just having access to the vaccine. Again, they're being shipped. And then having a distribution process set up so people know where to go and how to get the vaccine. So this is exciting stuff. So hopefully this, again, answers some of your questions. So what is phase 1? These are, again, the critical and healthcare workers. It was initially designated as this phase 1A. And these, just to summarize again, patients and workers in acute care hospitals, residents in skilled nursing facilities and long-term care facilities, dialysis centers, home health care. And then they've opened it up to Orange County law enforcement. This is primarily Anaheim and Santa Ana, where we're seeing really high COVID cases. And then people 65 and over. So again, this is opening up a whole nother category of patients who are now eligible to be part of this phase 1A. Priority is going to be given to those who are the most vulnerable. And that, again, people with underlying health issues, 65 and older, will probably take precedent over somebody who's 65 and healthy. So how do you sign up? You're like, oh my gosh, I'm 67 and I'm really interested in getting a vaccine. Where do I go? So currently there's no statewide registry. They do anticipate a registry opening up sometime in the next month or two. The California Department of Public Health has information on their website, so you can write this down, but it's cdph.ca.gov. It was last updated yesterday, so it's pretty current and it can give you some information. The other website that's come to my attention from my patients who are actively pursuing the vaccine and answers on how to get it is othina.com. And this is on the California Department of Public Health website as well, that if you scroll down, you'll see that link. So what is Othina and who are they? They're basically an end-to-end COVID digital solution, and they are designed to manage the vaccine process. So they are now in Orange County. So Othina is working with the Orange County Department of Public Health and in helping with vaccine distribution. And it helps connect patients to the vaccine distributors. So pretty interesting. I mean, it's basically an IT company that's coming in and trying to help navigate how to link up phase 1A patients to where to go to get the vaccine. Again, most people have this conception that, oh, I'll just go to my doctor's office and get it. Again, because this is such a massive vaccine distribution program, the trickle down to the doctor's office is not going to happen, as I'll talk about. It's going to be on a much larger scale. So again, othina.com is a great website to go to really get some information. I try to log on as a new user about a half a dozen times over the course of several hours this morning. And what I got was a message that says we are experiencing exceptionally high volumes of traffic, and it doesn't let you log on. So you can try to be patient or try to log in off hours, but I didn't have any success this morning. So the question is, who will be supplying the vaccine? Who's going to be giving the vaccine? And according to LA Times, and again, I'm getting a lot of my information from local press. Again, very little is being given to me. The Orange County Medical Association I'm a member of is not doing a great job of informing doctors as to what's going on. So fortunately, I have patients that are asking me to, hey, Dr. Sunshine, will you look into this for me? We want answers. And it really came to a head yesterday. We had maybe a dozen patients really wanting to say, hey, I'm over 65. Where do I go to get the vaccine? So it kind of forced my hand to figure this out. And we know that vaccines are going to be being distributed in Disneyland. So this will be the first super vaccination site in the country. So it's kind of exciting. Don't just show up, you'll be turned away. But apparently Disneyland will be one of 5 large vaccination centers to be set up in Orange County. Every state will determine how the vaccine will be distributed. This is through the governor's office. So it's really a state by state distribution process. And then with those states, they're going to be giving authority to their counties. So these county health departments are really going to spearhead these vaccine campaigns. So again, it's not going to be done through the typical healthcare distribution means, through doctors' offices, through hospitals. No, it's going to be much different on a much larger scale. With Disneyland, they're going to hope to vaccinate thousands of people daily. So again, it's going to be exciting. And I think this is where people who were able to sign up through othina.com are going to be told where to go once they get an approval. So most people say, well, gosh, am I just going to be notified when it's my turn to be vaccinated? And that's another question that we don't know. But you can go to occovid19.ochealthinfo.com. This can give you some information about how to find out when it's your turn to receive the vaccine. The FAQ section is very helpful and can answer most of your questions. It's really chock full of a lot of good answers to commonly asked questions. Again, this site will also direct you to othina.com's website, where you can try to sign up to get vaccinated if you're part of phase 1A. Most people who are eligible for the vaccine will be contacted through their employer to set up an appointment. And again, I think that's going to be in the next several months. That's not going to happen right now. I think it's going to be people taking an active role in seeking how to get vaccinated if you want to be part of that phase 1A, or if you are part of the phase 1A and you want to get vaccinated, it's really going to be up to you to sign up to get vaccine, to receive the vaccine, to know where to go. So again, walk-ins will not be accommodated at the Disneyland site. So again, if you have any questions, text me through the Spruce app, and I'll do my best to answer those for you. If you call the office and you have vaccine questions, we're going to send you a copy of this video. So a little bit more about vaccine distribution. Most pharmacies are not offering the vaccine. However, CVS, Walgreens, and some of the other chain pharmacies will soon start. They have a partnership through the federal government, and we knew this was going to be the case. Again, I think the volume that we want to try to vaccinate people, it would be too overwhelming for pharmacies and doctors' offices. That's why they're starting these super vaccine centers, as I mentioned before. So again, that's where I think the first, the 65 and older group who are looking to become vaccinated are going to be going to these super vaccine sites. The Pfizer and Moderna have pledged to provide 400 million doses. So you think, great, there's 320 million people in the U.S. However, you got to remember, everyone needs 2 vaccines. Both the Pfizer and the Moderna. It's a 2-shot series. So again, that will help 200 million people. Again, children under 16 cannot receive the Pfizer vaccine. Has not been studied in children under 16. And children under 18 cannot receive Moderna's vaccine. So that eliminates a big segment of the population as well, because we haven't studied in children. They're least vulnerable as well. So there are ongoing studies currently with children between 12 and 17 receiving the vaccine, and data will be forthcoming probably sometime in the spring. There are no current studies looking at pregnant women in the vaccine. So there will be no information about that anytime this spring and probably this summer. So there was an executive summary that was conducted by the Orange County Healthcare Agency. They did a survey, they sent it out to a lot of people and got 26,000 responses. So they thought there was a high enough number to publish their findings. And they found that in Orange County, 58% of people are willing to be vaccinated. So again, it's just over half. The most willing to be vaccinated, when you break it down by subgroups, are retirees, students, and disabled or unemployed people. And least willing to be vaccinated are the first responders, which to me was quite surprising, construction, maintenance, and landscape workers, and homemakers. So again, there's a lot of concern about, gosh, is it safe? Is it effective? I think we can say with some certainty, with high level of certainty, this is a very safe vaccine. There are no latex products. There's no chemicals. However, there's no food. If you have food allergies, they're not putting shellfish or antibiotics in the vaccine. So you can rest assured. Again, if you do have a history of allergies, such as to food or to prior vaccines, you will be watched for 30 minutes after you receive the vaccine and make sure you don't develop a reaction. So again, we think it's very safe, and we hope it's effective. We really don't know the efficacy. Some people think, well, gosh, you're going to have to be getting vaccinated every 3 to 6 months after you receive the first 2 doses. We don't know. So we'll know more probably by this summer. So I thought those were interesting facts I just would share with you. And then lastly, people ask me, what can I be taking for viral prophylaxis? There are studies looking at vitamin D supplementation. We know that people who have the lowest vitamin D, who get admitted to the hospital for COVID-19, are nearly 4 times more likely to die from the infection than people who have a normal vitamin D level. So I am recommending 5,000 IUs daily with food. Vitamin D is a fat-soluble vitamin. I do recommend it with vitamin K. It seems to help with vitamin D assimilation. We rarely see vitamin D toxicity. Some physicians really have their heels dug in about not recommending high doses of vitamin D, but we don't see any toxicity reports of people who take higher levels of vitamin D, and it can certainly be protective. Vitamin C, 1,000 milligrams daily, zinc, 30 to 50 milligrams daily, and quercetin, 500 milligrams twice a day. I also was sent some information on a supplement called monolaurin, which is from coconut oil. The recommendation is 300 to 600 milligrams daily. However, there are no peer review evidence found in human studies that this has any antiviral effectiveness in humans to ward off virus. But I do want to thank that patient for sending me this information, and thus I've included it. So again, I want to thank you for listening. Hopefully this was informative. If you want to hear about other topics, I'm doing this weekly. And my aim is to really educate my patients so that you get cutting edge information for questions that are really rising in the current news. And I'm really happy to be able to provide this to you, and look forward to answering your questions and giving you future talks on topics that you want to hear about. So thank you so much. We'll talk to you soon.